Good morning, everyone. My name is Dante, and I'm one of the great human resources representatives here at Care Synergy. Now, I know what you're thinking. Oh, great. Here comes HR to tell us what we can't do. But that just isn't the case. Today, I've been asked to visit with you to go over some tips for setting professional boundaries in the workplace. Firstly, let's review some of our objectives. We want to define what professional boundaries are, explore how to set and keep boundaries, go through some examples of crossing and breaking boundaries, explore what to do when your boundaries are crossed or broken, and then review what ethics are and what the Care Synergy Ethics Committee can do. Follow along with me while I review some really useful information that will certainly help you throughout your career. What are boundaries? In our world of hospice and home care, we may see patients in an inpatient care setting, facility, or we may visit with them in their homes to provide care. It is important to establish limits for acceptable behavior during these sessions. Allow me to elaborate. Let me ask you this. If you were eating lunch and somebody just walked over to you and took a bite of your sandwich, would you appreciate that? No. How about if you were working with a patient and another staff member walked into the room and started singing a Beyoncé song really loudly? Would you be okay with that? If they were good singers, then maybe, but generally the workplace is not the appropriate setting for some of these behaviors. In order to work well with others and some interesting personalities, like those who sing loudly in public or those who like to eat the lunches of their coworkers, we set up boundaries that other staff agree to abide by, both officially and unofficially, in an effort to work peacefully with others. But let's officially define it. A boundary is a point or limit that indicates where two things become different. It is an unofficial line that separates what should and should not be done in a certain setting. Boundaries help define acceptable behavior, in our case, at work. We want to ensure that we have professional boundaries set to avoid getting into situations that are too personal or inappropriate for the workplace. It is important to understand why boundaries are important. They allow us as professionals to focus on our patients' care, prevent compassion fatigue and burnout, prevent patients from feeling betrayed, abandoned, or poorly served, and prevent legal risks or dangerous and unethical behavior that may jeopardize your licensure and career. Here's a little known piece of information. Boundaries actually increase patient satisfaction. It may be hard for some people to set boundaries, so here are some helpful tips on how to do so. 1. Maintain clear expectations right from the start. In this case, we can say, "Hey, this is my lunch. Please don't eat it." 2. Explain your role, its limits, and your availability. I will be here Monday, Wednesday, and Friday to provide care for you from 12 o'clock to 1 o'clock, not to sing Beyoncé, unless it really helps you and you ask nicely. And 3, train patients on how to contact your team for help on evenings and weekends. Do not give out your personal cell number. Instead, have them utilize the main number for your team. Setting boundaries may be hard, but keeping boundaries is also a challenge. We care about our patients. We meet them in their homes and deliver highly personal care. Many patients are lonely and seek companionship with their caregivers, but we must be vigilant, however, to ensure that the relationship between you and your patients remains a professional one. Let's review some examples. Think about the following scenarios and tell me, do you think any boundaries were crossed? Who crossed the boundary? And what should be done in that situation to rectify the issue? Start by reviewing Michaela and Darcy's story, and then Todd and Christine's. This is CNA Michaela and her patient Darcy. Michaela has been providing care for Darcy for 3 months now, and they have a great rapport. One day, while she's feeling well, Darcy asked Michaela if she can share her social media profile with her so they can be friends and chat when Michaela is not with Darcy. Michaela, only wanting to be nice to her patient, agrees and becomes friends with Darcy on social media. Later that day, while Michaela is providing care to another patient, Darcy begins to send her messages that she is lonely and wants Michaela to come back to spend time with her. Michaela, who was unable to answer her phone while providing care to a patient, notices the messages later on. She feels badly for Darcy, but she cannot deviate from her schedule to come back to spend time with her. She messages Darcy and makes her aware of this. Darcy gets upset and begins to post to Michaela's page, commenting on her pictures and posts. Michaela is now feeling uncomfortable about the new dynamic that her patient-provider relationship has turned into, but she is not sure how to handle the situation. Can you tell me, was a boundary crossed? Who crossed it? and what can be done about this situation? Was a boundary crossed? Correct. Healthcare providers should never give their personal information to a patient, including their social media information, personal phone numbers, or home addresses, regardless of their relationship with the patient during visits. Can you tell me who crossed the boundary? Are you sure? Let's try again. Correct. While Darcy, the patient, initiated the crossing, CNA Michaela was the one who provided her personal information, so she broke the boundary by allowing the patient to think it was okay. Now that Michaela is uncomfortable with the situation, what can or should she do to resolve it? Are you sure? Let's try again. Correct. Michaela could talk to the patient and nicely let her know that they can no longer be friends on social media, as it is against the organization's policy to do so. Michaela should also have a conversation with her immediate supervisor to make them aware of the situation in case it escalates any further. Seems like you're getting the idea, but let's examine one more scenario. Are you sure? Let's think about that again. This is Todd, a nurse who has been caring for his patient, Christine. Todd has a long commute to get to work to provide care for Christine, and he was frustrated when he arrived this morning due to traffic. When he gets in, he realizes he has several more patients added to his list for the day. Todd and Christine have a good relationship, so when she asks him how his morning has been going, Todd doesn't hold back and begins complaining about his traffic-filled commute. Seeing that Christine is listening to him, he continues to complain about his organization and how they are short-staffed and overworked. Christine tries to be compassionate, but seeing that Todd is having a bad day, she decides not to tell him that her pain level has increased, as she does not want to cause more work for him to get her pain medication. Christine experiences more pain after Todd leaves her room to go to other patients, and now regrets not informing him of that fact. Later that night, Christine informs another nurse of her increased pain and that she didn't inform Todd earlier, so she didn't receive any medication. The nurse asks why, and Christine informs her of Todd's unprofessional conversation earlier. The nurse knows this was not good patient care. Let's review this situation. Was a boundary crossed? Are you sure? Let's try again. Yes, healthcare providers should never use their time with the patient to complain about things in their life that are bothering them, and especially should never speak ill of the facility or organization where they work and where the patient is receiving their care. This also holds true even if the patient is in their own home. Can you tell me who crossed the boundary? Are you sure? Let's try again. Correct. In this case, Todd, the nurse, was the one who crossed and broke the boundary between him and his patient. Christine did nothing wrong, though it is unfortunate that she felt the need to withhold pain information. This has caused her to receive subpar care. Can you tell me what can be done about the situation? Are you sure? The patient already brought it to someone else's attention. Let's try again. Yes. In this case, the patient brought this information to the attention of another nurse. It is now that nurse's responsibility to bring that information to her immediate supervisor so that they can address the issue directly with Todd. Not bringing this information forward would be a compliance and ethics risk, so it needs to be brought forward regardless of Todd's relationship with this nurse. Seems like you're understanding things really well. Let's move on. It may not be such an easy decision to do the right thing, especially when that decision could affect someone else. If that person is a close coworker, a friend, or a family member, it can be even more difficult. How do we know what the right thing to do in those situations is? Well, we may be able to rely on our code of ethics. Let's talk about that. What is a code of ethics? Well, it is a set of principles of right conduct that can guide us and help us to know what to do in certain situations, even if nobody else is around. Making ethical decisions means using personal morals and common sense to make choices. A code of ethics helps us to treat others the way you would like to be treated. with respect and dignity while not violating any personal rights. We can review a set of principles that can help to guide us in an ethical dilemma. Let's begin. Number 1. Service. As healthcare employees, we all work to elevate service for others above self-interest. We draw upon our knowledge, skills, and values to help people in need. Number 2. Dignity and human relationships. We treat each person in a caring and respectful fashion, mindful of individual differences and cultural and ethnic diversity. We understand that relationships between and among people are an important vehicle for change and engage people as partners in this process. Number 3. Competence and scope of practice. We continually strive to increase our professional knowledge and skills to apply them in practice. We are aware of our roles and responsibilities, and we work to provide care within our knowledge base and collaborate with others when needed. Number 4. Integrity. We are continually aware of our organization's mission, values, and ethical standards, and we practice in a manner consistent with them. We act honestly and respectfully in all interactions with our coworkers, patients, and their families. Number 5. Keep all information confidential. Any discussion of patient information must be done in a private area where nobody can overhear it. This includes discussions that are necessary and related to your client's care. It is also not okay to talk about patients in other patients' homes, store shopping lines, or restaurants. Number 6. Report anything that can harm. You are a mandatory reporter in all states. This means you are required to report any type of abuse or neglect to the appropriate authority immediately. This includes physical, mental, sexual, and financial harm. If you follow the principles we've covered here today, you should have no issues being ethical in the workplace. However, what happens when the decision of something being ethical needs more than just your personal views? That is when we can engage the Ethics Committee. The Ethics Committee is a group that was formed to provide ethical guidance to staff in a particular situation. It is not a governing, decision-making group. Rather, it is one that allows for open discussion of specific scenarios so that we can proceed in the most ethical way possible. Let's take a look at some examples of past situations where the Ethics Committee was able to review a situation and help provide more clarity to patients, caregivers, and staff. In our first example, our patient John no longer has the capacity to make medical decisions. His care team is concerned about the proxy decision maker who is making decisions that are not in line with the wishes that the patient expressed before losing capacity. What is the legal and ethical thing to do? Generally speaking, proxy decision makers, medical powers of attorney, and guardians are not allowed to override the patient's previously expressed wishes. There are exceptions to this, of course. We talked about this in committee, and in the end it was recommended that the team follow the proxy's wishes to the extent that they were consistent with the patient's own expressed wishes, which were quite clear. Once the proxy decision maker understood that she could not override these wishes, the conflict subsided. Let's take a look at another example. In this next situation, our patient, Pat, a mentally alert patient who is receiving home health services, is residing in living conditions that appear to be unsafe to the clinician. Pat has been educated about home safety as well as alternative living options. The staff caring for her is distressed about these conditions, yet the patient, who is able to make decisions for herself, vocalizes that she has no desire to leave her home and wishes to remain there. What is the legal and ethical thing to do? This is an example that we encounter frequently. In this case, the clinician called on the Ethics Committee chairperson and they reviewed the specifics surrounding the patient's living conditions. For example, are there children in the home? Is there active drug use? Maybe there are rodents present. Is it just our perception that this living situation is unsafe, yet the patient feels perfectly safe there? In some cases, it may warrant a need to reach out to the authorities, but in this case, it did not. While the clinician and staff had the perception that the patient's living conditions were too unsafe for the patient to remain in their home, the patient disagreed. Ultimately, it was determined that there was nothing unethical that was being done to prevent our staff from caring for the patient. Therefore, to respect the patient's wishes and rights, the patient remained in their home, and it was determined that no ethics consult was needed. If you feel you may need to engage the Ethics Committee, your first step is to speak with your direct supervisor or manager and bring the situation to their attention. Well, we've reviewed a lot today. Let's go over the things we've discussed. We defined what professional boundaries are, explored how to set and keep boundaries, reviewed examples of crossing and breaking boundaries, what to do when your boundaries are crossed or broken. We discussed what ethics are, and what the Care Synergy Ethics Committee does. For further guidance on Care Synergy's Code of Ethics, refer to Section 5 in the Employee Handbook. I really appreciate you being here with me today, and I hope you found this session to be educational. Have a great rest of your day. You've now completed this module. Click the exit button below. See you next time.